right. So, like Kimberly said, my name is Jasmine Garland-McKinney. I received my PhD from the University of North Carolina at Greensboro. I am a licensed clinical mental health counselor associate and a national certified counselor. Um, and so I'll be talking a little bit today about prioritizing Black maternal mental health, learning from the knowledge of experts, and I'll tell you a little bit about what that means when we get further into the presentation. Um, and I also do want to be transparent and apologize that I am feeling a little bit under the weather today. So if I need to take breaks to get water, I will do that. And I just want you to know nothing's wrong. I just think maybe we're coming down with the flu. But we're going to make it work. So let's go ahead and get started. To tell you a little bit about what we're going to do today. So first, I, of course, want to welcome you and introduce you to the topic that we'll be talking about. I'll give you a little bit of prior knowledge, background knowledge about maternal mental health. I'll ask you what you know about maternal mental health. I like to be really interactive with the presentations that I do. So I'll ask you to put some things in the chat if you feel comfortable. And then we'll get into what the experts say, what the experts said in the study that I ran. And then I'll have some time for questions in closing. So for our objectives today, I hope that you, when I'm finished with this presentation, what I hope that you'll take away from it is that you'll be able to discuss the current state of maternal mental health research, what actually is out there right now, and what we're trying to learn now from Black women and birthing persons. I hope that you'll be able to define the term perinatal race-related psychological stressor, which is actually a term that I coined myself from my research. And I hope you'll understand a little bit about what that means in the context of Black women and birthing persons' experiences. So I always like to start presentations with telling you a little bit about me. Of course, there are the professional titles that I told you about, being a counselor, a therapist, a doula. All of those things are really important to me, but at the core of my work really is being a mom and my own perinatal experiences, which is what propelled me into this work myself. You'll also probably see a little hair bobbing down here. It's because I have my little girl with me. So I like to be transparent about who I am behind the work that I do, because it really propels me forward and motivates me to be able to do this work really well, and to be able to speak about it in a way that I'm so passionate about. It's because of my own life experiences. So these are my girls and my husband. So in the chat, I hope that you feel comfortable enough to be able to tell a little bit more about where you're from. We already did that a little bit, but also what you hope to gain from today's community of practice. So if we could take just a brief pause, and then you share in the chat what you hope to gain today from our community of practice. And I'll have my chat up so that I can read. Yeah, and we'll take just a little bit of time for you to put what you hope to gain today, right? If there's some responses coming in, learning more about mental health opportunities, loving to learn more about resources on the topic for providers, how to better care for people as a nurse and midwife, and also how to bring this information into nursing and midwifery education. That's really important, Grace. Thank you. Tools and resources to share with pregnant members. Very important. Learning more about Black maternal mental health that's centered on Black birthing people. Thanks, Tawana. So yeah, these are all very, very important things. Keep them coming in the chat, and I'll keep reading them as they come. And I hope that I am able throughout my presentation to be able to touch on some of these things. We only have an hour, unfortunately, so I'm not sure that I'll be able to cover on all of it, but I hope that I'll be able to cover a good amount of it. And also in the chat, please feel free to talk to one another as well. talk to one another and gauge each other's opinions and experiences. So when you hear about Black maternal mental health, just that term, Black maternal mental health, what comes to mind? What do you already know about this topic? What are some stereotypes, some myths that you may have heard about Black maternal mental health? When you hear this, tell me what comes to mind. Put that in the chat. Feel free to unmute if you feel comfortable doing so. Suzanne, is that okay if people unmute?
Certainly. Yeah.
Okay. So if you feel comfortable unmuting, you can unmute to tell what comes to mind. You can put it in the chat. It says stress comes to mind when you hear Black maternal mental health. Black moms don't feel heard and their concerns aren't adequately addressed.
Mistrust comes to mind for me.
Mistrust. Dismissal.
The lack of accurate information that is centered on Black women.
Right. And we'll talk a little bit more about that too, Tawana, a little bit later. Expectations of strength, awareness, being overwhelmed. Yes, these are all very, very important things. Generational trauma, very important things. And it's interesting that I'll cover, I think, every one of those in my presentation today. So let's go ahead and get started because you all have a wealth of information already. So let's start with some statistics. I think it's really important to set a foundation of knowledge so that we're all on the same page. So these are just some really important statistics to be aware of as we talk about maternal mental health. The first is that Black women and birthing persons are 2 times more likely than white women to experience a maternal mental health condition, and then 2 to 3 times more likely than white women to experience a maternal death. So the latter is one that you probably have heard more often because within the maternal mortality crisis, a lot of times we hear about the physical side of things and we don't necessarily hear as much about the maternal mental health side of things. But the statistics are not great on either side. So I wanted to make sure I called attention to that. Next is that 40% of Black women and Black birthing persons experience a maternal mental health condition. However, when we think about that number, we know that 50% of these cases of postpartum depression specifically in women of color are not reported. So there are a lot of reasons why these aren't reported, and we're going to get into more of those a little bit later. When we get into being not reported, we also get into these maternal mental health conditions not being diagnosed at all or them being misdiagnosed. So what that means is that a Black woman or birthing person may go in for anxiety related symptomology and then come out with a bipolar diagnosis, which isn't correct, and that there's a bunch of different factors at the root of it. But one of those is that there is increased provider and societal judgment. And so that decreases Black women and birthing persons' desire to seek help from providers because they fear that they might be judged. They don't really trust the system. And those are some of the things that you all were talking about within the chat. So Black women are not likely to report their instances of mental health symptomology because of this fear of being dismissed, being judged, and then perceived negatively. One of the things that comes to mind too is, and I'm not sure if anyone has any familiarity or is in the Child Protective Services realm. I can't remember from when you put in the chat where you are calling in from, but there's this fear that if a Black woman or birthing person is to disclose mental health symptomology, that Child Protective Services might be called on them because they are a danger to themselves or their children. So that fear sometimes keeps Black women and birthing persons from seeking out mental health care, that fear of judgment. All right, so what contributing factors do we have to maternal mental health disparities? There are several sources. I'm sorry, give me 1 second. I need to just so there are several contributing factors to maternal mental health disparities we see, several. These are only a few, but I wanted to touch on these because they're rooted in the social determinants of health. So when we see the social determinants of health, number one, we think about racism and discrimination and how that might be at the root of all provider interactions. We also see that there is some chronic and environmental exposure to racial discrimination, and that's from multiple sources. So not just within the healthcare and mental health care realm, that's within law enforcement, within finances, within neighborhoods. So all of these chronic environmental stressors contribute to stress that might lead to maternal mental health disparities. The next thing that we see is that there are systemic and provider related failures. And so that's within the interactions with Black women and birthing persons. So just like some of you said within the chat, there is mistrust because providers don't necessarily give the same treatment to Black women and birthing persons that they would to another woman or birthing person of another race or ethnicity. So we see this lack of high quality, safe, and respectful health related interventions across the board. So that's physical and mental health. And we have seen within the reproductive justice literature, that there has been a call for more respectful birthing person-centered care. So what we see when we are talking about these different kind of systems of care, more respectful, we want to do everything that's opposite of what is on this slide. So we want to take all of the social determinants of health, take them into consideration, and then change the way that we are giving care. Do we have any questions so far? That was a lot of information. I always want to stop and see if there's any questions or thoughts. I'll wait in the chat. Okay, I'm not seeing anyone. So on the other side of things, I always like to think about things from both sides of the totem pole. So a lot of the times, I think when we talk about Black maternal health or Black maternal mental health, most of what we see is negative. And so I always like to talk about sources of support, sources of joy for Black women and birthing persons. So number one, we see social connections are very important. So depressive symptoms tend to decrease when there is really significant sources of social support, like co-parenting partnerships, extended family relationships, and kinship networks within that perinatal experience. We also see on the other side of things, when I talked a lot about negative provider-patient interactions, if we have positive provider-patient interactions, those support perinatal experiences. So you see decreases in maternal mental health symptoms when we have positive provider interactions. The next, though not last completely, is independent coping. So Black women and birthing persons, because there is this systemic distrust, stigma, and bias within maternal mental health and physical health symptoms, we see a lot of independent coping, which basically means that Black women and birthing persons are more likely to seek informal sources of support than they are to seek formal sources of support, like doctors, midwives, nurses, psychiatrists. They're more likely to seek out maybe religious sources or support from a close network of friends. All right, so that kind of gets me into the study that I ran. So I looked at all of this stuff within the literature, and I thought to myself, what are the stressors that make Black women and birthing persons experiences unique? What are the stressors? Do we even know? And we actually don't. We didn't know in the literature what these stressors are. And so I wanted to conduct a study that really talked to maternal mental health experts to be able to see what these stressors are. So who are the experts? I talked to nurse midwives, psychologists, doulas, clinical mental health counselors, social workers, a doctor, psychiatrist, psychologist, and marriage and family therapists to really gauge their opinions on what the stressors are within Black women and birthing persons' perinatal experiences. So from that, I came up with this term, a perinatal race-related psychological stressor, which is defined here. And you'll see that it is related to the historic and ongoing mistreatment of Black women in the United States. And so that is specific to Black women's perinatal experiences. And it's not something that is seen within women of other races and ethnicities, their perinatal experiences. So I talked a lot to these experts about what it is that they were seeing and what that meant for the women and birthing people that they were seeing within their practice. So on the next slide, I'm going to take a little bit more time because there are quite a few quotes and it'll take a little bit of time to read it. So I'm going to pause on these slides to give you all a chance to read. And then I want you to put your thoughts in the chat when you read it. So for this question, I asked these experts, how are Black women and birthing persons impacted by perinatal race-related psychological stressors? And this is not an exhaustive list. Again, I had 26 participants, so I couldn't include all of the quotes here. But these are some of the quotes that I got about how Black women and birthing persons are actually impacted by these stressors. So I'm going to give about 3 minutes to read these quotes and then put your thoughts in the chat if you feel comfortable. All right, Suzanne says stress, excuse me, mistrust, not feeling supported or prepared, minimalized or ignored. Right. So there are kind of these overwhelming themes of negative impacts to pregnancy and postpartum based on these unique stressors that Black women are going through. Anyone else have any thoughts about the quotes that are on this? Yeah, Grace, it highlights the need for structural and systemic change. There's an impact of distrust on healthcare. There's more blame for conditions, excuse me, attributed to Black women and Black birthing patients, economic constraints, having to go to work sooner with minimal maternity care. Yes. So there are a bunch of different stressors that we see within here that contribute to negative mental health, negative mental health within pregnancy and postpartum. So these, what I saw within this work here, I'm going to move to the next slide with more quotes. When I was doing this work, and because I'm a therapist myself, when I looked at the mental health measures that we have now, which brought me to the work that I'm doing right now within measurement and instrument development. But when I compared these stressors that are mentioned here from these experts to what we're seeing on mental health measures, like the Edinburgh scale, for example, I didn't see these stressors reflected. So one of the things that I thought to myself was, how are we measuring mental health symptoms if the stressors that these women and birthing people are experiencing are on the actual symptoms? All right. So what types of perinatal race-related psychological stressors do you see? Here's some more quotes, and again, I'm going to give a little bit of time for you all to read these quotes, and then Ginger, I'm going to read your message in the chat once the time is up. A little bit of time to read these quotes, and then again, put your thoughts and the first things that come to mind when you read these. All right, Amelia says fear. Ginger says, I can relate to the dismissing of birth plans because I have seen it in action. Providers, unfortunately, are pushed to focus on the numbers, not the individuals, right? Ebony says, stigma associated with speaking up. I think that was for the previous one, but it's definitely relevant to these two. So there's this kind of overarching not being seen, exactly, not being seen, having to extend energy to counter how society views Black women and mothers to ensure that they receive respectful maternity care, respectability politics. Yes. So what does it mean to present yourself well? And what is the standard of presenting yourself well? And how might that impact you mentally to have to worry about presenting yourself when you're already worrying about pregnancy, you're already worrying about the physical demands to your body, then you have to add a layer on top of that to worry about what you look like and how you might present to your providers. The other thing here is the worry to have to review your medical chart, to have to make sure that it's documented accurately. That's just an added layer on top of all of the worries that already come with pregnancy and postpartum. Thank y'all for contributing to the chat. So this is one of the final questions that I asked because, like I said, one of the things that I always have to say in my brain is how can we make this system, make these experiences better for Black women and birthing persons? And so if I had these experts here, in the study that I was working with, they had to have extensive experience working with Black women and birthing people in their practice. Most were in private practice, some were in community health agencies. But I wanted to know what has been helpful, what has helped the Black women and birthing people that you've seen in your practice. And these were some of the answers that I got. Again, I'll pause so that you all can read. Validation, no excuses, previous experience with the birthing process. So having more than one child is what that means. Seeking out Black OBGYNs. Wanting to feel like they're not crazy for experiencing the stressors that they experience or for exhibiting the symptoms that come with these stressors. So this is so important for us to understand for mental health practitioners, for medical practitioners, doulas, for everyone who interacts with Black women and birthing people. These stressors are so important to understand because they underscore how a Black woman or birthing person approaches the entire perinatal experience. So if you are having to have these worries in the back of your head all the time, then that is going to impact how you interact with the systems of care that you're in, how you interact with the healthcare system, how you interact with the mental health care system, because you're already going in there with your guard up because of a lack of trust, because of the fear we talked about, because of the respectability politics that we talked about. All of these things have to be considered in order for us to provide really respectable care. I want to mention weathering. Does anybody know? I'm going to kind of put y'all on the spot here. Does anybody know what weathering means? Anybody want to explain the term? Yeah, Suzanne says it's along the lines of chronic stress, environmental, and other factors, literal weathering down of the body due to increased cortisol. Yes, Grace. So those are great definitions. And one of the things that I talked about in the study that I ran was weathering. So the study is by, I'm sorry, gosh. The study is by Geronimus. I think her first name is Anne, and she basically saw that Black women's bodies were significantly older than compared to white peers because of the chronic and environmental stress, racism, discrimination, all of the things that we talked about, the social determinants of health. She found that Black women's bodies, their biological age was older than what they presented because of the chronic environmental stress that they endured. So yes, that is a great point. Thank you for bringing that up, Juana. So we kind of talked about the things that you saw in these quotes. There's so many: mistrust, fear, stigma, bias, provider interactions. What can we do to make the system better? Do we need to listen to Black women? Do we need to have Black women at the forefront of their experiences? Do we need more Black providers? What really is it that we need to make this system more respectable and better able to serve Black women and birthing people? So thank you all for contributing to the chat. So Nina says case management is providing education and empowering pregnant women to advocate for themselves. Exactly. So this is kind of not catch-all is what's coming to mind, but that's not the correct term. But this quote from Taylor, who is a licensed clinical professional counselor, and keep in mind too that these are all pseudonyms, so Taylor is not really the participant's name, it's a pseudonym that they chose. This quote really signifies everything that I saw within the study. So I'm going to read this. I think it comes down to a fear of not being heard or not being valued. In a medical context and in general, when Black women are not heard or when we are in the presence of those who judge us as not being worthy of high quality care, we are in danger. Pregnancy and childbirth are such vulnerable times in a woman's life. We have to depend on others. Psychologically, that's terrifying to think that someone might not do their due diligence to protect both you and your child, and yet you need that medical care. So you're forced to engage with a system that has proven to be flawed at best when it comes to caring for our people. If that's not a recipe for anxiety, I don't know what is. So I chose this quote to kind of sum up all of the findings that I saw in my study, because it signifies why it's so important for us to consider the unique stressors, the perinatal race-related psychological stressors that Black women and Black birthing people face during pregnancy when we're thinking about mental health symptoms. Because if we don't consider these stressors, then we can't really consider the symptoms that we're seeing, because the symptoms are going to show up differently because the stressors are different. So does anybody have any, before I move on, does anybody have any thoughts about Taylor's quote? Improved care, relationships in our care, getting to really know your patients, remembering noting details, and letting them know you on a more personal level. Exactly. Exactly. And Laura, that's kind of why I always like to start my presentations with a little bit about me on the personal side of things, because I think it shows you who the person is behind the work. And that's so important in relationship building. All right. So that kind of brings me, so Tawana says it illustrates structural inequities and how this is by design. Yes, exactly. So at the root of all of these healthcare systems, there's this structural flaw. The systems are flawed. Um, so thank you for pointing that out, Tawana. So that kind of brings me to these three areas that I like to talk about: awareness, accountability, and action. So we need to be aware of these stressors. First of all, that's a lot of what I talk about. We can't do anything about the stressors if we don't know about them. And so that's one of the reasons why I wanted to call attention to them, is because we have to be aware of them to do something about it, right? The other thing is accountability. So the reason why I made my study so interdisciplinary is because I wanted professionals to be able to learn from others. So we can't exist in silos. We are all great at our own individual professions. However, learning from other people is going to be the key to being able to solve these maternal health disparities and really fix the system from the ground up. And then action, like I'm talking about fixing the system, we have to be able to account for the cultural nuances in Black birthing persons and Black women's experiences during the perinatal period to be able to do anything about them. So we have to know about them, be accountable to ourselves and others, and then take action ultimately. All right. So in sum, I am so happy to be able to talk to you all about my research, to be able to tell you about the stressors that Black women and birthing people face, and then to talk to you a little bit about maternal mental health conditions. Um, as we end Black Maternal Health Week, keep in mind that Black Maternal Mental Health Week comes later on in July. There's more about the March of Dimes campaign to do Black Maternal Mental Health Week here. And so I don't know, Suzanne, if I need to give you my slides, but it is linked here so that you all can explore more on your own time. And then I wanted to make sure that I left a good amount of time for any questions that you all might have for me or about my work, about maternal mental health in general.
All right, and this is the time, if anyone wants to go off mute, you can go ahead and just ask your question aloud. I'll also go back through the chat just to make sure we didn't miss any questions that were sent along the way. But in the meantime, go ahead and go off chat. You can go ahead and ask your questions or your thoughts, or even any takeaways you have, any insights you have. Tawana, I'm going to turn it to you.
Hi. Okay. So how do you take care of your own mental health as you are doing this work? Because, some of the data that you have talked about doesn't fill you with fuzzies and like happy and joyful things. And so, as you did this work and continuing to do more work, like how do you take care of yourself as you do this kind of work?
That's a really great question. So I had to be really intentional about this, especially doing dissertation, which is when I did this work, because at the time I was also pregnant. And so I was interviewing and speaking with, which is why Cooper is right here, which is why speaking with, when I was speaking with Black birthing people, when I was speaking with the providers, I was also pregnant myself. So I think it was hard. I had to do a lot of memoing, a lot of journaling, a lot of consultation. Um, and then I think just kind of pouring into my own hobbies is helpful. I really like to cook and I like to bake. Um, so I think just doing the things that bring me joy, spending time with my family. Um, because I mean the data is hard. it's hard data, but I think it's also really important to be honest about the data, and this is where we're at, and these are the things that we need to do to make this data better.
I have a question. Because I work as a nurse midwife, and I feel like this is something we talk about a lot as midwives. Um, but I just don't hear as much from the OB community about the need to work on this. Like even there was a article posted in their AJOG, their journal this week, like that was pretty much gaslighting obstetric violence. Yeah, how do we get those people to also recognize that this is something that they too need to work on? And 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 I guess that still includes midwives too, but like yeah, from that provider level, I mean that's a big question. Um, but those are my thoughts.
Yeah.
Yeah, how do we make that better for them?
Yeah, that's a big question, a lofty question. And I think it's going to take time, which is kind of unfortunate to say. I think the entire field of medicine as a whole is built on Western practices that really aren't culturally responsive. So OBs, nurses, midwives aren't, even mental health therapists aren't taught culturally responsive practices. I mean, mental health is getting a little bit better, but medicine as a whole is very westernized. And so I think it's really at the root of these systems. And that's kind of what we need to work on doing a little bit better, which is why I'm really happy to be part of the Believe Project, which is working on creating medical and interprofessional curricula that is more culturally responsive, because at the root of the issue is what we're teaching students, residents, midwives, nurses. And I think someone said it in the chat about time. Like the time to be able to think about these things really isn't there for these professionals, because I mean you have 10 patients on your case. So I think it's tough. It's hard. And there's a lot of different factors that go into it. But I think overall it is very much a culture within obstetrics that needs to be changed. And I think it'll take time to change it, because obstetrics, the entire profession, J. Marion Sims was doing unethical practices on enslaved Black women. And so that's what the career was built off of. So it's going to take time to be able to change that. I don't know if that answers the question. I'm sure it doesn't, but I think that's the best answer I can give, is that it's going to take time. But I think the reproductive justice and birth equity field are doing the work that is going to change that, but it's going to take time.
No, that's helpful. It just, we get so stuck in our silos, and yeah, I think about that a lot. Like sometimes we think we're making a difference, but are we really? So yeah.
Right. And that's just like you said, that's one of the reasons why I wanted to make sure that the experts in this study were interdisciplinary, because we get so siloed in our field.
We do have time for a few more questions, or even just some overall takeaways or thoughts. I'd love to keep the discussion going and hear more about what people are experiencing in the field, or questions that you may have. I think that I'm also happy to pause sharing if we want to have, if we want more vulnerable conversations or questions to be asked. All right, well, I will go ahead and resume recording, and we do have a few more overviews and some takeaways. I just want to thank Jasmine again for was such a great conversation, and for her time and her energy and sharing her research. If you wouldn't mind giving us an evaluation on today's community of practice, you can scan this QR code, and I can go ahead and drop the link again in the chat. That would be really helpful, especially as we plan out future webinars, collaborations, communities of practice. That would be really great. Some quick announcements.
And then if you would like nursing contact hours, I'm actually going to drop that link in the chat now as well.
Thank you so much. So we all know yesterday concluded Black Maternal Health Week, and I just wanted to shout out Kimberly and her sweet daughter Christina for going on the Mame Walk Run Stroll fundraiser this weekend. And there you can see our 4th trimester, I believe, and our little goodies on the table. And I know everyone has been around doing so much work to help support and promote and raise awareness and have these deep conversations. So shout out to everyone that's really, rolling their sleeves up and getting into this work. Some upcoming events that the Believe and the 4th trimester team will be at, we hope you can join us virtually or in person, is the Smart Start Conference in May. Jania is the keynote of the Gold Lactation Conference. It's free and it's Zoom or in person on May 13th. We also have at the end of the month, wrapping up again, Black Maternal Health Week and month, and we're continuing the celebration in Durham on April 30th. And the Believe team is partnering with Rose and NCANT for the Uplifting Black and Brown Lactation Success Conference in August in Greensboro. And if you scan the QR code, you can subscribe to our newsletter and make sure that you have all of this in your inbox. And you know about even more events that are coming up. I know that we're missing a bunch, like July has, there's an event in Houston for Black maternal mental health, for Shades of Blue, and there's a bunch of other conferences that we will be sharing and highlighting. And I wanted to just shout out the Believe team for different ways you can connect with them. BelieveIPE.org is the website. You can also go BelieveIPE.org/subscribe to subscribe to the newsletters. They're on Instagram and have some great posts and behind the scene content of all of the different work and partners on Instagram. And they're just launching this week some podcast reels that are really exciting, really highlighting the community voice and partnerships on a variety of different postpartum and Black maternal health topics. So be sure you're following them on Instagram and subscribed so you can see the launch of the podcast reels. And here's an example of the first one. I'm not sure if we have time to play it now. And then the 4th trimester, of course, we have the resources. We have a new resource center that you can search and filter resources by. We have a toolkit for both providers, community organizations, and for mothers. And so you can see in the little bubbles are the different types of resources that are in that toolkit. And then if you go to newmomhealth.com/resources, you can filter for printable or video, different languages, different audiences, things like that. And then we also have a reel series, and a new one is coming out with Nurse Nikki on breast and managing breastfeeding and breast pain and care in the postpartum. You can always rewatch, this is just some FYI, you can always rewatch communities of practice, including this one, at newmomhealth.com/community of practice. I'll be sending an email afterwards with the link to rewatch some of this. And Dr. Jasmine Garland-McKinney has been so kind to allow us to share this with our network so we can put this online. All right, well.